Jess, talk to us about your shoulder. Tell us everything that's going on, all your symptoms, who, what, where, how, and why, and we'll go from there.
Okay, so nothing's really changed. I'm just finding a lot of pain when I'm waking up. So I'm tossing and turning each night because unfortunately I sleep with my arm underneath the pillow. So yeah, a lot of pain in that.
Does it wake you up?
Every night.
Is there a certain time?
Just when it starts to get that really sharp pain.
Yeah.
Yeah.
Is there a regular time, 1 a.m., 2 a.m., or is it just sporadic throughout the night?
Nah, sporadic.
Can you get back to sleep?
I don't know if you'd call it good sleep, but I literally just turn from side to side because that's the side I prefer to sleep on. So if it starts to hurt, I try the other side and yeah, no good.
So it's worse if you sleep on that right side?
Absolutely.
Yeah. How long has this been going on for?
It seems to have gotten a lot worse since I've started training with heavier weights. So maybe since May, 4 months? Is that 4 months?
And when you say lifting with heavy weights, is that Pilates going heavier? Or is that
no,
gym
actual
stuff?
weights training.
Okay.
On top of Pilates. So Pilates has a lot of shoulders as well in our classes. So doing the weights on top of that.
Yeah. Where are you training?
Elite.
Oh, over this way?
Yeah.
Kilo. Nice.
Yeah.
Have you got PT or are you doing stuff on your own?
PT.
Sweet.
He kills me.
How long have you been seeing him?
Since May.
All right, since May. Okay.
Yeah, so cool. When this shoulder has gotten worse since then.
Yeah, cool. So there is a correlation. So one of the things there as well is night pain is not the best thing for us. We sometimes want to just flag that and think, okay, maybe there's something else going on. But the fact that you've got a correlation between the fact that you've started going heavier and shoulder pain probably means that that night issue is a bit more inflammatory in terms of like tendon-related pain, which is the reason why you're waking up and that. Right, so that's good. Let's dive deeper into that PT stuff and actually what you're doing. You've been seeing him since May. How many times are you training?
Upper body only once a week with him and lower body once a week.
Okay. Are you finding that there's an actual exercise that makes it worse, or is it just overall when you do upper body?
I think it's just overall because once you mix in the Pilates on top of that with all that shoulder work, it's...
How many times do you train in Pilates?
About 4 times a week.
When you do upper body in the gym with him, is it push and pull? Is it back and chest?
Yeah, it's a mix. Yeah.
How do you feel? Do you do any bench?
No.
Okay. Do you do any shoulder pressing?
Yes.
How's that feel?
It feels fine when I'm doing it. Sometimes that shoulder feels a lot more weak than my left-hand side.
Yeah.
But I just push through it.
Yeah.
Probably shouldn't, but I do.
Are you doing any rehab or anything like that to make that shoulder feel better?
I do see a myotherapist every now and then.
Right, and what do you do with them? Strength work, tissue work, like massage
No,
work?
it's more just massage and dry needling.
Do you find it helps?
For a little bit.
Yeah.
Yeah. I think I just need to be more consistent with it.
So the first thing I want you to try and link is if there's an association between what you're doing in the gym, sometimes it's really hard to figure out. At the moment, we definitely know that it gets worse with heavier weight and upper body stuff.
Yep.
Try and dial in and see if there's any exercise in particular that it doesn't like. So what you should be looking out for is that first rep. Oh, how does that feel? Even if there's a like, oh, that doesn't feel great, change it. Because it probably means it's provoking something that's going on with that. The first thing that we need to do is definitely try and break away from the things that aggravate. And sometimes it's quite hard to figure that out, right? After you've done the upper body, you might find that everything aggravates. Every time you're going to pick something up or you're trying to go overhead, that's not the thing. You need to go to this position and find out what's aggravating in the gym, all right?
Okay.
Often, any back works, anything where you're pulling towards the body is going to be okay with shoulder issues.
Yep.
Normally what's worse is when we go overhead or when we're pushing away from the body. Push-ups, bench, lateral raises, shoulder press, all of those sorts of things.
That's probably my weakest.
Okay.
Yeah.
And do you still do it?
Yes.
Right. And is it weak because it hurts, or is it weak because you just feel like you've not got the strength?
I think it feels like I just don't have the strength.
All right.
My mind says that I do, but my body says no, just on that one side.
Yeah.
And the other thing is that I should probably tell you, it almost feels like if I put my hand above my head and go too far back, it feels like it wants to come out of its socket.
Feels vulnerable.
Yeah, very.
Yeah.
Yeah.
Do this with that left one, show me. So that's what you feel, that's the position you feel vulnerable.
That's fine, yeah.
But if you do it right?
On that side, yes, yeah.
Right, so let's talk about your symptoms. Going overhead, it feels vulnerable, end of range, right? What else do you feel? If we've met for the first time, how does that shoulder feel? What's happening?
Sitting here right now is fine.
Yep.
When I'm using my arms like to pick up something or whatever, it's this pain like in here.
Yep.
And I can't really describe exactly where it is. It feels like it's like right in there.
But you can't touch it.
No.
Yeah, it's really common, that sort of area.
Yeah,
so in this sort of area, it's the subacromial space, and often we've got lots of structures in there that can become irritated and pain sensitive, which can refer out.
Okay.
So often we get pain in and around this lateral shoulder, but we don't actually find an area where it's really sore, but it's somewhere.
Yeah, I know it's in there, I just can't.
That's really common. All right. Are there any movements in particular that really aggravate, like day to day? That you're like, what about, for example, seatbelt?
Like it might twinge a little bit, but it's nothing hectic. It's more the sleeping that I can really feel it.
And especially waking up.
Yeah. I mean, it's bad enough that I'm not a great sleeper anyway.
And what does it feel like when you wake up?
It's a very hard thing to explain. It's almost
Stiff,
like
painful.
It's painful and stiff, but it feels like I don't know how to describe it.
Yeah, okay. Just something's going on.
It's so painful.
Okay, classic.
And it hurts to like pull my arm back down, if that makes sense.
Yeah.
Like it's not my arm.
Yeah. The thing is, right, it's classic behaviour of tendon-related issues in the morning. It feels stiff, feels really sore until you kind of get it going, and then it starts to desensitize. How long does it take for it to start feeling normal?
I guess every day is different.
Yeah.
Depends on, as you said, what I've been doing.
Yeah.
If I go to the PT, it's going to feel worse the next day.
Yeah, okay. So I think that sentence there is definitely something that we need to dial in on.
I don't want to stop.
You don't have to stop, you just have to modify.
Yeah, okay.
What we've got is if we've got this training volume here where you're happy, you're enjoying all of that load, you're training push, pull, legs, upper, whatever it is, we do not need to bring you down here to the position where we're resting. Because then what we have to do is we'll go all the way back up here anyway, right? We don't need to do that, it's unnecessary. If we bring your load down on that shoulder a tiny bit to the point where it doesn't aggravate, we then only have to go this far. And this means that we only might need to just stop doing overhead stuff, which you don't quite get yet. Like it might be the thing that aggravates it, but you can still pull, you can still train your back very heavy, you can still train your arms, which is great. It just might mean we have a bit of a deload from that chest and those shoulders, and then we rebuild. And what we do is we introduce one exercise at a time, we see how that goes. It's a process of elimination.
Okay.
All right, and we might have to scale some things. So for example, if you're doing full push-ups and you're doing sets of 10 or something like that, maybe we drop that down, we scale it down to go to the knees, so there's less load through that shoulder. And if we can get away with that, then that's what we do. So we try and keep you as task specific as possible. So try and keep you doing the things that you actually enjoy and that doesn't cause an issue to the shoulder.
Perfect.
All right, that's definitely the first thing that you need to dial in on. Try and figure that out, all right?
Okay.
But like I said, it's more likely going to be things like the lateral raises, the shoulder press, the bench, or the pushing away.
Yeah.
What do you do for chest?
I don't do any chest.
Okay, cool.
At all.
All right, so it's just shoulders. Okay, right, so therefore that's already, changed that thought process. So it's the shoulder stuff that you don't like. Do you do any posterior shoulder stuff, like reverse flies and things like that?
Not as often, but yes, we have done in the past.
All right, how's your general health?
Very good.
Yeah. Right, you're training well, which is good. On average, how much sleep do you get? What do you try and get?
7 to 8 hours.
Great. And when you go and see the myo, when they do dry needling and tissue work, where do they focus?
I mostly focus around like my neck and my...
Easy, right. So we've got a shoulder. If we could say, what does the shoulder feel like? Does it feel stiff? Does it feel weak, unstable, painful?
Weak, unstable, and painful.
That's quite a nice thing for us. Right, so listen, this is where we're at.
Nice for you, not so much for me.
The three main things she mentioned there is weak, unstable, and painful. And we like to categorize the shoulder into 4 different groups based on pretty much the subjective stuff. So what she said. Does it feel stiff? She hasn't mentioned stiffness once really, other than when she's waking up, but that might be related to the painful side of it. So we can probably exclude that. The unstable, typically this is associated with trauma. So when we've actually had a traumatic event such as a dislocation, normally the static structures such as the labrum, the ligaments and the capsule, they've become compromised and they might need a bit of a help, bit of a hand from a consultant or something like that. We need to look into that. The other 2 is this weak and painful. These are the 2 most common groups of the shoulder issues that we find, and we've got to figure out why it's painful and why it's weak. And often when we target those, that's when the shoulder starts to get better. So we need to go into this assessment here and try and figure out what's going on here. So we're going to go into that now. So now we're going to go into some assessments to try and figure out which category we can put that shoulder into and then go after that. So nice and simple. We're just going to get the shoulder moving. So whilst you're in that seated position, just take the arms overhead for me. If any time you get any pain or if it doesn't feel right, let me know. Can we go any further than that?
Pain.
Where?
This shoulder.
Beautiful. Come back down. How's that feel on the way down?
It's not too bad on the way down.
Okay. And how does this feel?
Yeah, that's where it starts to hurt.
All right, so we've got a lack of range in this overhead position, flexion into elevation and abduction. Right, let's go here and let's just rotate out for me. How's that feel?
Not too bad.
Good. Let's take this arm into abduction like this. Let's rotate back. So you can clearly see that there's no signs of stiffness here. How's that feel?
Pain.
Right.
I can feel the pain, but it's not too bad.
Okay, go down. How's that feel?
Stiff. Like I have no rotation.
So true stiffness in and around the joint means that active, where she does it herself, and passive is stiff. There's no stiffness here. So the capsule is all good. I'm not worried about that category. We're going to get that one out of the way. The other 3, the unstable, the weak and painful, these are the ones we're going to look at. So the unstable typically does not like to be in this apprehensive position here. Well, if they've got instability there, they will not like to be there. I've mentioned this before, quite a few videos. Abduction, which is where the shoulder comes up into external rotation. Classic dislocation territory is this position here, when we're grabbing something, when someone's taking us in here. Right, if we relax here for me, nice and chilled, so we're nice and relaxed here, and I'm gonna take you back there. What happens there?
Yeah, that's painful.
All right, sweet, good. Right, let's do that again without me. How does that feel?
Feels like it's gonna come out of its socket.
Good, okay, come back. So what we're gonna do there is that feels apprehensive, right? So hold there for me. And we're just gonna add an A to P glide of that humeral head and let's rotate back. Same, better or worse? No change?
No change.
Good, right, come back here. All we're gonna do now is add some resistance through those internal rotators of the shoulder. So I'm gonna try and drive back. I want you to put the brakes on, but let me win. So we're gonna slowly go here. So straight away she's pushing down, but I now want to see this come back towards me, but slowly. Keep that resistance going and stop when you're not happy, or if you feel good, keep going.
I can feel the pain.
Yep, okay, keep pushing back here. A bit more, pain is there, or, yep, sweet, so we've got this issue. So she's not happy in those sorts of positions. That's definitely something that we want to see. So we had some apprehension, wasn't happy in that external rotation and abduction, so I just want to test it in this position as well when we're laying down. So again, just let me know if you have any issues. Nice and slowly, nice and relaxed. I'm just going to take you back. I'm very cautious here, very careful. I'm looking for any changes in her face.
Yeah, I can feel it.
Right, cool. Come back. Let's do the same thing again. I've now added a nice glide to that humeral head again.
That does feel better.
Feels better. So that's a positive test for apprehension. So we've actually got this pressure through the front of the shoulder. And you can see here already she's happier, another 20 or 30 degrees there compared to where she was feeling symptoms first here. Okay, so we're gonna go into a little bit more strength testing now. And I love to test the ability for the rotator cuff to look after that shoulder. Rotator cuff is that dynamic group that really provide that compressive force to the shoulder that gives us that stability when we're moving in and around overhead or in an outstretched position. We love to test an external rotation, internal rotation, and all planes where we're in abduction and also going face down as well. So a few little simple tests, elbows tucked in, stop me from pushing in. All right, good, come again, let's do it again. Come on, give it a bit more. Beautiful. Any pain?
Not so much.
Okay, and then we're gonna go in against my hand. Any pain?
No.
Okay, let's go up into this position and stop me from pushing down. Any pain?
Yep.
All right, so abduction, resisted in external rotation, produces a pain response. Let's get you face down. And I wanna test in this position where we're on our front. We're gonna do a similar sort of thing. We're looking for quite a similar ratio between external and internal with the strength there. If there's too much of a difference, I definitely want to close that gap, and I also want to see if there's a difference left to right. They were quite similar, but we did have a pain response, so it means that she couldn't put more power through, because if she did, she'd have even more of a pain response. So pushing down against my hand, so we're going to go to resisted internal. How do you feel here? Okay, let's relax, and then push up against my hand here. So there's another way which you can kind of get that resisted external painful. Typically found when we've got weakness in here, when we have a tight muscle, it's typically weak. And often with weakness, we have trigger points in around that tissue as well. So whenever we've got deficits in external rotation strength, I often come to the infraspinatus on the back of the scap here, and I have a good old prod around here. And often we have trigger points that often refer into that same sort of space. So we've got trigger points in infraspinatus, we've got weakness in that muscle as well, but that typically that group where we're rotating backwards. So again, we're trying to categorize the shoulder. We've definitely got weakness, and we've definitely got pain. We've got a little bit of apprehension as well. So whether or not that's true instability, I want to see if we can improve this and if it will influence the unstable feeling and stuff like that. Remember, the rotator cuff as a group protect that shoulder, and they're the things that if we're working well there, it will make that shoulder feel nice and stable. When they don't work so well, whether that's due to a pain response or we've got trigger points and stuff, it will make it feel like, oh, I don't trust this shoulder. It's not very happy. I'm not very strong. And that's probably where she's getting that relationship between the weakness when she's pressing overhead versus the left side, right? So we're stronger in that left because we're not having a pain response. So this is definitely something I want to see change. I'd also like to have a look at the overall motion going through the back. These are other things that we can look at through overhead, so into extension, flexion, rotation. But at the moment, I want to focus in on around that. Okay, so we're going to start off with some symptom modification stuff by loading that shoulder. So like I said, we have pain in resisted external rotation. Let's see how it responds when we start loading it up with just some basic isometrics. Okay, so all we're going to do is start off pushing it up against my shoulder. All right, and we're just going to hold. We're going to hold here for around 15 seconds. We're going to do about 3 sets, and we're just going to see if there's any change. And rest there. Right, isometrics, and then we're also holding there. I'm going to press down. I want to win, but put on the brakes. So now we're just eccentrically loading that tissue as well. And I just want to see if it desensitizes it when we're going into positions initially that cause pain. Okay, let's go again. We're going to do 3 reps here. How's it feel?
It's a little bit sore.
Good, don't mind that. Let's go again. Right, keep going, keep going, keep going. And now we're going to go straight into that hold. Don't stop, and just keep pushing up against my hand. Another 15 seconds. So this is quite a big thing for me. Like, I reckon if we get changes here, this shoulder's going to feel a lot better. Whether that's related to some tendonitis, tendinopathy in and around that shoulder, who knows, probably. But the fact that we've got deficits in strength in external rotation is something that I want to see change. And rest there. Let's go elbow straight. Let's go both arms all the way above head. What do we feel here?
It does feel a little bit better.
Okay, come back down.
Yep.
It's not magic, it's just desensitization to the tissue, but it just shows that it's potentially related. Let's go up to elbow straight, up towards the ear. Tell me when that kicks in.
Yeah, about there.
All right, range is better. So we had an abduction around here before we had pain, which is cool. Let's go here, bend, and let's rotate back for me. How do you feel here?
Yep, I can feel the pain now.
Yeah, where do you feel that pain?
It's like in that spot that I can't touch.
Easy. We wanted to categorize that shoulder into, out of the 4, we wanted to try and figure out at least where it kind of sits so that we can start targeting that. Definitely got the painful side of it, we've got the weakness, but there's also that feeling of instability, certainly when we go overhead or when we're coming back into this position, it feels like it wants to pop out. Now, the external rotation of that shoulder was weak and it produced a lot of pain. So I've just spent the last 5 minutes loading that posterior cuff up, so in external rotation. We had her face down. We loaded 15 seconds at a time, but we also were doing eccentrics in and around that position as well, so really overloading that, and then at the same time trigger pointing that infraspinatus to just see if we could get any change in the symptoms. So if we go into this position, abduction into external rotation was a real problem before. The range is better. We've still got pain. How does that feel?
Yeah, much better.
Feels less. So why that's happened, maybe because we've just desensitized that tissue, but that's a nice positive correlation for us to go after. The fact that that's improved because we've gone after that shoulder, good. I want to reinforce that a bit more. Right, let's go overhead. Get up as far as you can where you're happy. How does that feel?
Much better than before.
So it feels like it's improved as well. So again, a nice reinforcement in that position. So the apprehensive feeling of going into this sort of area has calmed down just from loading up that posterior cuff. So that tells me that I want to go after that. And then the power. So if we go into that position here, stop me from pushing in. Maybe that feels a bit stronger. Let's go up here, stop me from pushing down. How does that feel?
Stronger than before. I can still feel it a little bit, but...
So we've still got pain, which is cool, but maybe there's a little bit more power output. So we're going to reinforce that. We're going to go downstairs and we're going to actually hit some exercises which we're going to improve that strength. All right, so we're going to try and strengthen up that position there, external rotation. We're going to try it with the rings. We can make this a lot easier if we get into a more upright position. If there's a little bit of discomfort, don't mind. If there's pain around 2 to 3 to 4 out of 10, sweet, we're good. So we're effectively going to walk ourselves down and we're going to try and pull ourselves towards the rings in this position. So note that I've done that and I haven't done that, okay? It's not an easy exercise. Start off in a nice upright position, pulling in towards the face. And then we get hold and then we're going to control it on the way down. Elbows up. Good, and then you're effectively going to go back this way. There, hold and control on the way down. Great, how did that feel? Pain? Good, let's go. All right, so you'll feel lots of tension through here. Great, let's go again. So if you've got a TRX, access to the TRX or rings, this is something that you can absolutely do. Lovely pause at the end there and controlling it down. Now I like to do this one instead of just the dumbbell one that we're doing after this, because the maximum amount of tension is going to be at this point here when we're in this shortened position, whereas when we're working with a dumbbell, because of the way gravity works, there's no tension on that cuff. So if we keep going, we're working really hard, and even just holding here is great. And there's controlling it down. There's an easy way to make this tougher. Obviously go a bit more parallel to the floor. We could slow it down even more. We could actually just do more reps, but this looks great. So we're getting this back fired up. Look at that. What a back. Controlling that down and rest there. So bring it in. So these are ring face pulls into external rotation. So that's 3 sets of 8. I want you doing probably 3 times a week. Let's get after that. Next one, take a seat on here for me. Face me, shuffle this way a tiny bit, put this right foot up on here, like that, put this elbow here, and we're gonna grab a dumbbell, and you're gonna control this down. So this is elbow supported dumbbell external rotation. It's a bit of a mouthful. We put the elbow on the knee here because we offload the delts and the traps, and we're effectively gonna control this all the way down. So this is that lovely eccentric element, and we can get quite heavy here, and then we're gonna pull it back. All right, so I'm just gonna grab a dumbbell. At the moment, we're only using a 5 kilo. 5 kilos in this position is actually very heavy. So we're gonna control this. We'll see how we go. I'm gonna help support this just because it is gonna be heavy. Slow, slow, slow. Keep going, and let's get it pulled back up. So if you've got access to 1, 2, 3 kilos, there's nothing wrong with going for that in the first place. You can see here, that is very, very heavy.
So heavy.
Good, and then coming back. Well done. And again, give me one more. Controlled, slow, and back up.
So getting back up.
Keep.
So that's where I've lost all
so that's the concentration, but that's heavy anyway. You could always use the other hand to help that to get back up. So what I'd like to do is I'd like to start off with some heavy work first. So if you've got access to 1 or 2 kilos, we warm up first in that position. Then I want you to work with 3 sets of 5 with a good 90 seconds rest in between. So the 5 reps, I want you to actually work quite heavy. That's 5 kilos. I think it's a bit too much. Probably a 3 or a 4. That's exercise number 1. Exercise number 2, you're going to do the rings. This is all going after that external rotation strength, which is where we're weak and which is where we've got a pain response. So we're going to try and do it so that we're not in too much pain. A 2 or 3 or 4 out of 10 is absolutely fine. And as the weeks go on, if we do that 2 or 3 times a week, you're going to find that you get stronger, the pain is going to get less, and overall those symptoms in and around the shoulder are going to improve. That shoulder at the moment, we've got pain overhead in this position, we've got pain coming out up towards the ear, so there are 2 things which we can measure. And then the other thing which we're going to measure success by is how she's feeling in the morning. When she gets up in the morning, it's a large amount of pain, which is also waking her up, especially when she's sleeping on that right side. So those are the variables there that I want to see some changes in. And I think we're going to get that changed if we load it up, get that stronger, and if we get those trigger points to calm down in that posterior cuff. So we're going to check back in probably 4 weeks' time. We're going to see how she's doing and also make sure that she's doing her rehab. This is not going to change unless she goes after it. And remember, the other thing that we want is we want to see a change in what she's doing at the gym. If there's something that's aggravating, specifically shoulders in overhead, we're going to try and come away from it. Because at the moment, that shoulder is not happy, it's compromised. Whenever she's asking it to work hard, it reacts, and this is why her symptoms are worse that night and then the next morning. So if we can get on top of that, we're going to break that pain cycle. We're then going to load it up, target the areas which are weak, and hopefully that shoulder starts to improve.